Hey everyone, it's Marianne Pizzatola, president of the New York City Organization of Public Service Retirees, the organization that brought the lawsuit against the city of New York to stop them from forcing us into a Medicare Advantage plan and leave our choices on the table. We are doing a series of short little videos today to go over a document that we put out that we call the one-pager, which was to educate the actives and the unions as to the differences between Medicare Advantage and traditional Medicare. So this is part 2 of that video, that series of videos. So I'm going to continue with this one pager that we put out the other day, which was to the unions by our full board. And on the back, it explains the differences between traditional Medicare and supplemental plans versus Medicare Advantage. We had sent this to over 215 union officers. And we held today a live webinar, today being April 22nd, held a live webinar for those unions. Many unions chose not to attend. I wonder why. I guess they're not looking to, hear some of this, but this seriously needs to be tended to. We need you to hear what's happening and why this is happening. We're trying to educate the active employees and the unions who will probably have to make a decision about this coming plan soon. And we want the active employees to know exactly what the differences are between both plans, as we recognize that while this is not on your radar, you're not familiar with Medicare or how it works, we want you to know the differences between traditional Medicare and Medicare Advantage. And that if you permit the unions, the MLC, and the city of New York to negotiate away this healthcare benefit, you are negotiating away a benefit that is going to affect us today because we are the Medicare eligibles. It will be your give back tomorrow, and you don't even know you're negotiating away your own health benefit. And let us show you how. So today, part 2, this video. So I have 4 points behind me. I'm trying to make 4 in each one of these little short videos. So the first one for today, out of network equals money. Under traditional Medicare, members can see any doctor that accepts Medicare, but Medicare Advantage plans have a network, as does this one, New York City Medicare Advantage Plus plan. If your doctor is not in network, members may have to pay up front and hope the service is determined to be medically necessary so they get reimbursed. If you have to pay and you don't get reimbursed, it doesn't count towards the cap on out-of-pocket expenses. Now, I want to show you this using their own words in their own documents. So here we go. I am going to share my screen with you. This document is the actual city contract with the Alliance. I'm going to navigate to the correct page. Okay. And I want to go to 12C. When covered services are provided by non-participating healthcare providers, the members' co-insurance, if any, for such services will be based on either Medicare's limiting charge, up to 115% of the Medicare allowed amount, where applicable, or the provider's billed charge. If the provider has opted out of Medicare, the member is responsible for the provider's billed charge. Payments for out-of-network services will be governed by the applicable federal and state law and CMS requirements. Now, this is specifically if they're not Medicare, but I'm going to show you that this will also show that it affects people, his providers who are in Medicare who refuse to accept this plan. 16D, the parties acknowledge that the Alliance is not engaged in the practice of medicine. It merely makes decisions regarding covered services pursuant to the evidence of coverage. Providers participating in MA plan networks are not restricted from exercising independent medical judgment regarding the treatment of their patients, regardless of the Alliance's coverage determinations. Which means your doctor can tell you that you need a service, but if the Alliance isn't going to provide it, going to approve it, then basically they're not going to make that decision. You're on your own because they're still not covering it. Now, I want to bring you to, and this is also, by the way, in another document. Let's get there. This is the enrollment guide. So what if a doctor or other provider says they don't accept this plan? In the rare instance, and that's a joke in itself because there's over 500 documents in our court case that from providers, from retirees, notarized affidavits that say doctors or say, I'm not taking this plan, or I don't accept any MA plan. In the rare instance where a provider that accepts Medicare tells a retiree they will not accept payment from the New York City Medicare Advantage Plus plan, the retiree should first contact the concierge service that will be provided. So the plan can work with the provider to make sure they understand it is the same payment schedule and billing protocol and answer any questions the provider may have. Oops. If despite that effort, the provider still refuses, the member can pay the provider and then submit the claims to the plan for reimbursement. This then puts you in a precarious position because if in fact you submit the bill to the alliance, you are leaving it up to them to determine whether or not it's medically necessary, even though your doctor, the one prescribing the test or the procedure, thinks it's medically necessary. Your insurance company doesn't have to agree with you. This is not something we have in traditional Medicare. In traditional Medicare, your doctor thinks you need something, you get it. There's none of this back end, front end, doesn't matter. You're not going to get stuck with the bill. Explain how that works in prior authorizations. In Medicare Advantage plans, prior authorization has to be authorized before the procedure or the test. In traditional Medicare, it's done on the back end. And why is that? That there's a lot of differences between how this plan works and traditional Medicare works. However, one of the talking points of the Alliance, and I will show you that shortly, is that the Alliance likes to say that they're better because they do it beforehand. You can get stuck with the bill under traditional Medicare. No, that's not true. On the back end, if it's done in traditional Medicare, the authorizations are done at the end. And that is a rare circumstance, that procedure or test would not be approved or the billing would be denied, it's actually the provider, not the beneficiary, that is stuck with that bill. So there is a whole lot of difference with how this plan operates, and you need to know that on the front because this could cause delay to your care. Out-of-network providers aren't required, and we are here, middle of the page on the left-hand column, aren't required to ask for prior authorization. We encourage you to ask your provider to request it before you get care. Here's why. If the provider doesn't ask for prior authorization, Empire will review the claim after you've been treated. If the claim is determined to be medically necessary, we will process it according to the rules of your plan. If the claim is determined to not be medically necessary, we will deny the claim and let you know that you have the right to appeal the decision and the provider can bill you for the treatment. And that's if you haven't paid for it up front. But if the doctor's not accepting this plan as in-network or even accepting it for assignment, guess what? He wants his money up front. And this is why that is super important. Whether you see an in-network or out-of-network provider, if your provider does ask for prior authorization and it is denied, you will be notified. If you choose to continue with the treatment, you will be responsible for the cost, period. This is very different from traditional Medicare. We do not have this issue. Doctor says, hey, I need you to have this test. We go and have it done. Hey, you need to have this procedure. Let's schedule that for next month. You go and get it. There's none of this, well, let's ask the Alliance and see if they'll approve it. We don't have prior approvals. We don't have to go through a gatekeeper. This is a gatekeeper. Now, last page, enrollment guide, page 38, or LL, depending on what document you're looking at. Out-of-network, non-contracted providers are under no obligation to treat New York City Medicare Advantage Plus members except in emergency situations. Guess what, folks? We don't have that in traditional Medicare. You need to go anywhere, have any procedure done, any test done. If your doctor orders it, you get it. Medicare pays the first 80%, your supplement pays the last 20%, period. And that's after you've met your deductibles. Question 1, gone. Number 2, not all doctors who accept Medicare Advantage I'm sorry, not all doctors who accept Medicare have to accept Medicare Advantage. They can opt out too. And how does that happen? Happens in a few ways. Most doctors who accept insurances, they choose what products that they want to accept. You might see a sign on their window that says, hey, we accept all Medicare plans, but we do not accept Medicare Advantage. This is a Medicare Advantage plan. And you'll see that quite often. Even doctors have a form that they can complete to tell a doctor, if I can find it, that they do not want to accept this plan or any plan. And it is a provider opt-out form. And here you go. This side will tell them what plans that they are currently in and which corrections, if they show that they are in, which ones that they wish to opt out of. And you can check off, oh, I don't want to take HMOs, I don't want to take MA plans. And then, you know, the insurance company will call you back, and then you have to tell them, hey, I'm sorry, I don't want to be in this plan. So you can accept any HMO plan, any PPO plan, any whatever plan, Blue product that Blue offers. But if you don't want to accept MA plans, you can opt out as a physician, provider, hospital, whatever. Then I'm going to show you the next problem with this network is anyone can opt out. Any hospitals can opt out, providers can opt out, and sometimes they're actually kicking Anthem to the curb because they're not being paid. So now you live outside New York City, you're a retiree, you might live in a warmer climate. Wherever you are nationally, you risk your network not being there because this is a network plan. Medicare is not a network. There are no networks. The doctor takes Medicare, you go, period. And how is that? The Alliance will say, well, 96% of doctors accept Medicare. Yep, that's true. You know, 4% of the doctors in the United States don't. 4%. 2% of those are psychologists who take no insurance. So now you're looking at only 2% of physicians who are medical practitioners, not psychologists, psychiatrists, that don't take Medicare at all. Pretty much it tells you have a whole network for you available. This plan is very, very different. So in showing you this point, I want to bring you to the next item. Actually, I'll put that with number, yeah, and I'll bring that with number 4. Let's move forward. Number 3, the Medicare Advantage plan requires prior authorizations for tests or procedures, something that doesn't exist under Medicare. According to the American Medical Association, prior authorization leads to delayed medical care and patient care. This is another huge problem. And I will bring you to that screen. Let's see. This is the one. Nope, that's not the right one. Where's that one? Oh, here we go. Okay. This website is MedicareAdvocacy.org. And this is an organization, I believe they're in Connecticut, and a large group of attorneys in making sure that Medicare is protected. And things that are happening, they will highlight issues that are of late and show you what the problem is. This is one of those problems, is Medicare prior authorization, but the authorization is for Medicare Advantage, not Medicare. Prior authorization is a requirement that a healthcare provider obtain approval from Medicare to obtain a given service. Prior authorization is about cost savings, not care. Under prior authorization, benefits are only paid if the medical care has been pre-approved by Medicare. Private for-profit plans often require prior authorization. Medicare Advantage plans often require prior authorizations to see specialists, get out-of-network care, get non-emergency hospital care, and more. Each MA plan has different requirements, so MA enrollees should contact their plan to see when and if prior authorization is needed. Medicare prescription drug plans very often require prior authorization to obtain coverage for certain drugs. Traditional Medicare, historically, has rarely required prior authorization. Originally, the Social Security Act did not authorize any form of prior authorization for Medicare services, but the law has subsequently changed to allow prior authorization for limited items of durable medical equipment and physician services. Despite this change, there are still very few services requiring prior authorization in traditional Medicare. And this is very important because this is where we say that these insurance plans, because they are for profit, their concern is profit margin, not care. Here is an example. American Medical Association did a study, a physician study. They wanted to know how prior authorization affects their patients. So here you see this chart, care delays and abandoned treatment. Questions physicians were asked was, for those patients whose treatment requires prior authorization, how often does this process delay access to necessary care? So here, 14% said always, 42% said often, and 38% said sometimes. That was a 93% had an impact on patient care. This side, abandoned treatment associated with prior authorization. How often do issues related to prior authorization process lead to patients abandoning their recommended course of treatment? 3% said always, 24% said often, 55% said sometimes, and 16% said rarely. In that situation, 82% said that it often led patients to abandon their care. And this is because if you get denied, you then have to go through an appeal process. It's frustrating. So 34% of physicians report that prior authorization has led to a serious adverse event for a patient in their care. 24% of physicians report that prior authorization led to a patient's hospitalization. 18% of physicians report that prior authorization led to a life-threatening event or required intervention to prevent permanent damage or impairment. 8% of physicians report that prior authorization led to a patient's disability, permanent bodily damage, congenital abnormality, birth defects, or death. Now, why this is important is because as we get older, you'll hear Claire Levitt on these videos say prior authorization is just like in GHI CBP, but we're not on GHI CBP, we're on GHI senior care. Most of us have disabilities, or we are of age over 65, or we have some health problems, probably some or a lot of health problems. When you're younger, having a prior authorization may not have the same impact as it would with someone who has multiple health issues going on at the same time. This is where it can become a problem. That leads me to number 4. Providers can drop out of the MA plan at any time with no advance warning. This does not typically happen with traditional Medicare. This disrupts continuity of care and results from contractual issues and poor reimbursement. So to show you what that is, bring you to the next screen. And this will show you, these are a series of articles that we wanted you to see. Insurer under fire for millions in unpaid claims. And who is that insurer? Anthem. Anthem is the parent company of Blue Cross Blue Shield, the Blues. Anthem has captured the attention of multiple hospitals and health systems across the United States as allegations of underpayment and inappropriate denials accumulate. The insurer has been forced to pay millions of dollars already and continues to face off with providers. Anthem is facing allegations of $70 million in unpaid claims from Portland-based Maine Health. The health system said earlier this year that its flagship hospital, Maine Medical Center, would no longer contract with the insurer after its contract expires this year. And this is happening around the country. Georgia, the state insurance commissioner fined Anthem Blue Cross Blue Shield $5 million in this past March for failing to pay in a timely manner, delays in loading provider contracts, and inaccurate provider directories. That kind of sounds like the problem we're having with our provider directories, and this plan hasn't even gone live yet. VCU Health in Richmond last year said that 40% of its claims with Anthem were more than 90 days old, and the insurer owed $385 million. The Virginia Hospital and Health Care Association said Anthem has hundreds of millions of dollars in late and unpaid claims across the state. 11 Indiana hospitals also have trouble with Anthem. The hospitals alleged Anthem's reimbursement system added a $50 triage fee and asked for additional patient records to avoid denial for 60 to 70% of thousands of emergency room claims from 2017 to 2020. The hospital alleged the strategy breached their contract with Anthem because hospitals are required to stabilize all patients requesting emergency services. A federal arbiter recently ordered Anthem to pay $4.5 million to the hospitals and said the insurer cannot use its list of diagnostic codes to downgrade or deny claims. The Indiana hospitals are still counting the denied claims and said they are owed $12 million from Anthem due to downgraded claims. The American Hospital Association accused Anthem of asking for prior authorizations for routine surgeries as roadblocks to patient care in a letter sent to the insurer last year. In 2021, 53% of Anthem's medical bills for the second quarter were unpaid, amounting to $2.5 billion. This is serious, folks. We keep trying to tell you that this is not the way to go. Here's another article. This is from the Kaiser Health. Same issue. Major insurers running billions of dollars behind in payments, and who's at fault? Anthem. Here's another article, businessinsurance.com. Hospital seeks, and we just mentioned this in one of the other articles. This is about Maine. Here's another one also about Maine having unpaid claims. So when you start to think about some of these issues, this starts to, it's starting to add up. We want you to know that we're not looking to be part of this. If the city wants to offer a Medicare Advantage plan, any Medicare Advantage plan, and they've been offering Medicare Advantage plans since I believe 2003, it should be an option. So we're trying to educate you as to where all of these lies are coming from. Oh, and I do want to add a few more before I let this one go. I want to share a video with you. Let's go back. Is it on this one? No, not here. Give me 1 second. Here. Now, this video was recorded August, I think, 13th. I was very new at doing internet stuff then, like, recordings and whatnot. So what I want to do, you're going to see the video cockeyed. I just want you to hear the message, because that's really the most important part. Let me share my sound. And there's 2 parts I want you to hear here.
I did want to touch upon the pre-authorization aspect of the program. This has come up quite a bit on retiree meetings. The way the Medicare Advantage Plus plan works is in-network contracted providers are responsible for obtaining pre-certification for certain services. So that aspect is handled by the doctors. It is not a responsibility of the member at all. So the providers are the ones that work on this behind the scenes directly with the plan. And those providers know exactly what they need to do for pre-certification. Most services that require pre-certification are your planned surgeries and planned inpatient hospital stays, your complex diagnostics like your CAT scans, PET scans, MRIs. Those are the types of services that we're looking for pre-certification. And one of the reasons, as I mentioned, we do it on the front end so that there's no surprises. Medicare retrospectively will look at a claim, and there could be a circumstance where they may deny a claim after a service was rendered. So in-network providers are contracted and required to do this. Out-of-network providers are not obligated to pre-certify services, so they don't have to, but we encourage all providers in or out of network to pre-certify services so that the claims go through timely and that the provider gets paid. If they do not pre-certify, we'll pen the claim until we get the medical records. Once it's determined that medical necessity, all guidelines were met, then obviously the claim would be paid on. So, Cecilia, I don't know if...
Okay, so basically what she's telling you, even if you're out of network, you, the patient, the beneficiary, you need to ask your doctor to file an prior authorization request anyway, because you may not get paid. You may have to pay out of your pocket and not get reimbursed. That is up to you to ask for. And simply by submitting the bill to the insurer, you are asking them to give you medical necessity approval. They're just not gonna, you're just not gonna send a receipt in and they're gonna cut you a check. It doesn't work that way. So the next part I wanna share with you will be at about the 28-minute mark.
Are not required to see PPO members. What will happen is all Medicare participating providers are eligible to be covered under the program. And typically what happens is if a provider says that they will not accept the program, we're advising members to contact the concierge call center so that we can do outreach to that provider. Typically, it really comes down to simple education, that the provider needs to know that there is in and out of network benefits and that the Medicare reimbursement for out of network is the same as what they're receiving today. So we try to advocate for the member, and we will contact that provider directly to make sure that there is a continuity of care and that you'll have continued access to that doctor. We're hoping that the provider education campaign that we're doing proactively helps to alleviate much of this on the front end, so that we're doing outreach to these doctors today.
So right there, the doctors, she says it, the doctors don't have to be in their network. And if they refuse to even accept assignment, accept payment, even though they are out of network, you're still on the hook. So those are my next 4. This is part 2. I'm going into part 3 shortly. Please stay tuned. Please subscribe to our videos. And if any one of your union officers or active employees gets to see these videos, please share them the videos. We want them to know, here I am showing you, proving to you every one of these points on this one pager that we put out for the unions to try to educate them as to that they're being lied to by being told that this plan mirrors senior care and it's exactly the same. My district council president, Mr. Henry Garrido, has been telling people in emails that we are spreading disinformation. I'm here to tell you we're not spreading disinformation. This whole organization has been on an informational campaign to educate active and unions that you are being lied to and that we should have a choice of what plan that we want in retirement. You should be not stripping away our ability to choose plans that we want. This is super important because you're being misled that this plan is exactly the same. And I'm proving it to you using Kim Parker from the Alliance's own words and the EOC and the city contract. Anyway, stay tuned for part 3. Please subscribe.